Acute asthma attacks are often triggered by allergens. Inflammatory molecules called leukotrienes are one of several substances which are released by mast cells during an attack. The leukotrienes seem to be critical both in triggering bronchoconstriction in an acute asthma attack and in causing long-term hypersensitivity of the airways in chronic asthma. In the last two videos on asthma medication, we covered the bronchodilators and a number of anti-inflammatory agents. And in this video, we are going to take a look at drugs that are specifically designed to interfere with the activity of leukotrienes, or what is collectively known as leukotriene pathway inhibitors. Drugs in this group can either be a lipoxygenase inhibitor or they can be a leukotriene receptor antagonist. Leukotrienes are substances that induce numerous biological effects, including augmentation of neutrophil and eosinophil migration, neutrophil and monocyte aggregation, leukocyte adhesion, increased capillary permeability, and smooth muscle contraction. All of these effects contribute to the inflammation, edema, mucus secretion, and bronchoconstriction observed in the airways of asthmatic patients. Two strategies have been employed to block the actions of the leukotrienes in the airways as shown here on this figure. The first involves direct inhibition of the enzyme 5-lipoxygenase, which is responsible for the synthesis of leukotrienes. An example of this drug would be zillioton. The second strategy involves direct blockade or direct antagonism of leukotriene receptors in the airways, and examples of drugs that are currently used are zafirlukast and montelukast. Let us first focus on zillioton. Zillioton relieves symptoms of asthma through its selective inhibition of 5-lipoxygenase, the enzyme that catalyzes the formation of leukotrienes from arachidonic acid. Specifically, it inhibits leukotriene LTP4, LTC4, LTD4, and LTE4 formation. Limiting these leukotrienes in turn helps to reduce inflammation, edema, mucus secretion, and bronchoconstriction in the airways. Zillioton is effective in preventing exercise-induced asthma, cold air-induced asthma, and aspirin-induced asthma. It is also used to reduce nocturnal symptoms and bronchial obstruction in nocturnal asthma. In these cases, zillioton is usually administered orally 4 times a day. The most common side effects reported were sinusitis and nausea, and the occasional dyspepsia. And the most serious adverse effect is potential elevation of liver enzymes. Approximately 3% of individuals will have alanine transaminase levels that are 3 times higher than normal when receiving this medication. However, it will usually revert back to normal when the drug is discontinued. And it is for this reason that it is recommended to do measurement of alanine transaminase before therapy with periodic monitoring thereafter. And it is also because of this reason that the drug is contraindicated in individuals with liver dysfunction. Let's now move on to the leukotriene receptor antagonists. Upon administration, drugs such as zafirlukast or montelukast selectively and competitively binds to and blocks the cisternyl leukotriene 1 receptor, thereby preventing the potent pro-inflammatory mediators leukotrienes such as LTC4, LTD4, and LTE4 from binding. This prevents leukotriene-mediated actions, thereby reducing enhanced migration of eosinophils and neutrophils, decreasing adhesion of leukocytes, decreased monocyte and neutrophil aggregation, decreased airway edema, inflammation, and capillary permeability, as well as reducing bronchoconstriction. Zafirlukast and montelukast are not rescue medications, meaning that they are not used during an acute asthma attack because they do not act quickly enough. Staphylococcus is used as prevention of asthma attack. It is effective in aspirin-induced asthma that is caused by overproduction of leukotrienes resulting from the inhibition of prostaglandin synthesis by aspirin. Additionally, Staphylococcus is also effective in prevention of cold air-induced bronchoconstriction. Commonly reported side effects include nausea, diarrhea, stomach pain, headache, and cold symptoms, but in a very small percentage of patients, there have been reports of life-threatening hepatic failure with the use of Staphylococcus. Staphylococcus is not to be given together with warfarin because it produces an increased prothrombin time with possible risk of bleeding because Staphylococcus inhibits the cytochrome P450 enzymatic degradation of warfarin. It is contraindicated in breastfeeding mothers because Staphylococcus can pass into breast milk and may harm a nursing baby. It is available as a tablet and is usually dosed twice daily. Patients usually would take 20 milligrams of the tablet either 1 hour before or 2 hours after breakfast because food actually reduces the bioavailability of Staphylococcus. Montelukast is also used for the prophylaxis and chronic treatment of asthma in adults and pediatric patients aged 6 years and above. Again, it is not indicated for the reversal of bronchospasm in acute asthma. It is useful in prevention of exercise-induced bronchoconstriction, and it is also used as symptomatic relief for seasonal allergic rhinitis. Common side effects are similar to what you would see with Staphylococcus, but without the risk of hepatic failure. Montelukast is effective orally and is taken once a day, typically in the evening. And Montelukast is more commonly prescribed as compared to Staphylococcus because Staphylococcus require more frequent dosing requirements and because of the known severe toxicity with regards to the liver, but this is actually relatively uncommon. It only happens in a very small percentage of patients. Before we end this video, let's do a very quick recap. Leukotrienes, as you know, are a very important component of the inflammation in asthma. Basically, it is responsible for all of the signs and symptoms of asthma, including the increase in edema, increase in vascular permeability, bronchoconstriction, and whatnot. Leukotrienes are inflammatory mediators produced by activated leukocytes in which increased phospholipase A2 activity increases the production of arachidonic acid. Leukotriene pathway inhibitors is one of the group of drugs that are used in the management of asthma. Leukotriene pathway inhibitors consist of both inhibitors of 5-lipoxygenase and leukotriene receptor antagonists. Both classes of drugs are typically given orally and have been documented to produce beneficial effects in the chronic management of asthma. But bear in mind that they do not have a recognized benefit in treating asthma flare-ups, meaning they are not used as a rescue medication because it takes a longer time for them to exert their effects. Instead, it is used to reduce the inflammatory component of asthma and thereby is used in chronic management of asthma. If you like this video and you find that this video is useful, hit like and click subscribe if you haven't.